The vast majority of our patients, the first line of treatment is always conservative. We always try to avoid surgery if at all possible. Physical therapy, injections, as mentioned, corticosteroid injections. With the knee, there's other injections, viscosupplementation, which is like a lubricant. I tell people it's sort of like changing the oil in your car. But if you've got a run-down car engine, doesn't matter if you change and put the best oil in, sometimes that's not quite enough. PRP and stem cells, obviously, same thing. The evidence is not fully there, although it may be forthcoming. And then obviously joint replacement surgery when all else fails. So how do you know when it's time? Well, you know when it's time when, number one, we talked about you can't sleep at night. That's usually a good indication. When you've tried everything else on that list, when you've had injections, when you've had tried medication. Usually you don't wake up one day, your knee hurts for the first time, you come in and we don't say, all right, we're going to replace your knee or your hip. It's usually due to a more chronic condition where you've tried lots of things to get rid of the pain. And essentially when the key word for me is lifestyle. When people say that they can't do the things that they want and it's interfering with their lifestyle, that's usually when we know it's time. But not everyone's obviously the same, and what one person can tolerate is not always the same as what someone else can tolerate.